The Mission of Mercy has helped over 100,000 patients across the country and provided nearly $50 million in free dental services since its inception. This free clinic will soon be in Cape Girardeau, helping thousands of patients.
I'm Paul Roberts. I'm the Director of Outreach for the Missouri Dental Association. Mission of Mercy is a large-scale free dental clinic over a 2-day period that involves about a couple of hundred dentists plus several hundred more volunteers to provide free dental care for anybody in need. Mission of Mercy began in 2000 in the state of Virginia, and since then has grown to probably more than 20 states around the country. About 3 years ago, we had several of our doctors go and see one in Kansas and got a vision for it and said, you know, we can do that in Missouri. We can find a way to bring that here. And so the first one was held in Springfield, Missouri in September of 2011. After the 2011 inaugural event, we call it the MOMOM, the Missouri Mission of Mercy. We asked around to say, how can we make this a regular event for the MDA and the foundation that really sponsors the event. And we were asking for volunteers, and Dr. Jan Roop and the Southeast Dental Society stepped up and was eager to host it.
My name is Dr. Janet Roop, and I'm a local dentist, and I am the local lead for the Mission of Mercy 2 in Missouri. My husband, Dr. Pat Roop, I practice with him, and our associate, Dr. Nathan Sire, went to the first Mission of Mercy in Springfield, Missouri in September of 2011. When they came back from Springfield, my husband said, we have to host the next one. We really do. And the reason why he felt that way was because of the boot hill in Missouri, because of how high the poverty rates are, how much unemployment there is, just the great need down in the boot hill. And truthfully, to be able to host something like that, you have to have a facility large enough to be able to do that. There are no such facilities in the boot hill. The only two facilities that are large enough to host a Mission of Mercy in Southeast Missouri is the Show Me Center and the Black River Coliseum in Poplar Bluff. So we determined that we were going to try to bring Mission of Mercy to Cape Girardeau, Missouri, and try to get the Show Me Center. And luckily for us, SEMO has partnered with us. They've been an excellent partner and have been able to allow us to bring this, much needed mission to Cape.
To pull off an event like the Missouri Mission of Mercy takes a lot of things. First of all, it takes local leadership. The local committee led by Dr. Jan Roop has really been meeting together for over a year to fill the positions, the different leadership positions that are needed.
Because you need all of those people to make sure that you have all the bases covered. You have to raise the funds to bring a Mission of Mercy to your area. The reason why you need certain funds, for one, is that you have to partner with American Dentist Care Foundation. They are the people that bring the equipment in semi-trucks to the Show Me Center and help set it up. So for them to come and bring 100 dental chairs and 100 units, the cost is $35,000. So you know right away, to just be the bare minimum you're going to need is $35,000, and then it goes from there, securing everything that you need to raise the funds for a mission.
So we have to find the venue, we have to raise money for food and opportunities to feed the volunteers who are working all day. We have to find all the supplies to do the dental treatment.
Working with the facility, doing parking, doing hospitality, getting the dentists, the dental hygienists, the dental assistants that are so necessary to make the clinic run.
It takes a lot to figure out how to get the clinic ready to see 2,000 people in 2 days.
But basically what happens is on May 2nd, when the semis roll into town, we take over the Show Me Center and make it a dental clinic. And that takes 75 local volunteers and then all the people from the Missouri Dental Association and from American Dentist Care Foundation. And we set up this clinic so that it's ready first thing on the 3rd.
It's a first come, first serve clinic. So people will often line up several hours, maybe a day before. They'll camp out, they kind of police the lines themselves. And when we're ready to open the dental clinic, patients will come in. There's no requirement to have a driver's license or an ID or dental insurance or anything like that.
A typical day means that the patient first of all registers, and our registration, we are very blessed that our registration is being handled by Delta Dental of Missouri. Those people have been coming down the entire time that we've been planning. They did registration in Springfield and said, gosh, you know, Cape Girardeau is a lot closer to St. Louis than Springfield is, so we're going to come to every meeting. The two ladies from Delta Dental have been coming to every single meeting. They're bringing their entire office and they're handling registration. That's the first thing that patients do, is register. And then from there, they enter the clinic floor where they go through medical triage to see if they're medically able to be a patient.
Then they go to dental triage, and where a dentist will assess their most important need, what they think they would like to get done that day, and what we're capable to do in the clinic setting. And then from there, they're assigned to different areas of the clinic.
We do fillings, cleanings, we do some endodontics, which are root canals, only front teeth and only on people 26 years of age or younger. We do some partials, and we have 2 labs that are helping us, and we anticipate we're going to do several partial dentures. We have Edmonds Lab out of Springfield coming, and we have River City Dental in Cape Girardeau helping. So we feel like we are going to be able to do several partial dentures. And then the last thing that we'll be doing is pedodontics on any children that come.
And so after they go through dental triage, they are routed to whatever their greatest need is. So maybe you have a sore tooth that really needs to be pulled and you haven't had a place to go. There's no adult Medicaid in the state, and so this is an opportunity to get that tooth pulled. Maybe somebody else is hadn't had their teeth cleaned in several years, and the best thing they could do is to get a good cleaning from the hygienist. We'll send them over to that area. Generally 2 groups that find out about MOMOM. There's those who want to volunteer, and you don't have to be a dental or healthcare professional. We use hundreds of just lay volunteers who can come. They can park cars, they're a patient escort, they can work in food services, they can take out the trash. There's all sorts of ways that you can contribute to making this event a success. And to do that, you need to register, and you go online at www.momom.org, and you'll find very easy instructions to register. There are 2 shifts a day, 5 in the morning to 11 in the morning, and then 11 in the morning till 5 in the afternoon on the Friday and Saturday. Our goal is to have 1,000 to 1,200 total volunteers. We need about 200 dentists and dental assistants and hygienists in that group. The biggest thing that we could ask of any patients is to show patience, because it is a long day. It takes a lot of work to move that number of people through the clinic, so there's going to be a lot of waiting as you fill out your form and wait to be seen and to be treated. But our goal is that these people are a guest, and we're very excited that they're making the sacrifice of their time to come and wait in line, and we want to give them the best care we can. It's been very successful, almost to the point that we can't serve everybody. At the initial Missouri Mission of Mercy in September of 2011, we had 1,856 patients that we gave treatment to in 2 days, and that was over $1 million of free dental care.
So many people have so many things that they struggle with every day. I mean, just trying to put food on the table and get shoes for the kids and all those things. And unfortunately, sometimes their health takes a back seat because they have to prioritize.
I have 4 kids. I just can't afford to have my teeth fixed. So it's worth, if I just sit out here a week, I would, just to get it fixed.
A lot of people lost their job recently. They've been here since 2 in the morning, waiting all night with their tents and chairs, just waiting to get some sort of dental work.
Some people just don't have jobs to pay for insurance, and so you know, it's just really that's how it was for me generally. When I walked in the door, everyone was smiling, and they kind of motivated me friendly. And then when I got my teeth done, and the lady was telling me how good my teeth looked, and you know, she was, I couldn't believe it. So you know, when you get your teeth cleaned and things like that, it even makes you feel better as a person. You know?
From a volunteer standpoint, we have over 1,000 people involved with that. It's obvious that we could not see this amount of people without a lot of colleagues chipping in and helping out and being ready to work and give a great deal of their time and service to us. So, you know, it makes us proud as a profession. We're here to take care of people.
Not wanting to take pictures with my kids. It's hard. And when I knew I could get them pulled and get a partial and look a little better, I was all for it. It's worth it. It's well worth it. And they're so kind, and I was scared when I got in there and nervous and shaking and crying, and they was right there. I mean, it's wonderful what you guys are doing.
It's hard because I know that there's a huge need and we can't address everything today, but I just want people to know that we do care. We're here to try to help and do whatever we can to get people healthier.
You know, I feel like it's kind of our duty to do this. In our own offices, we're limited as to what we can do. There's overhead costs and things that go with doing dentistry. It's a very expensive thing to do, much less receive. So this just gives us an opportunity to see large numbers of people all at once, and with this number of volunteers, it's humbling to see how much can get done.